It's another beautiful day in winter here in Queensland. I was asked to do if I could cover DIC, disseminated intravascular coagulation. I'll say that again, DIC, disseminated intravascular coagulation. And I can, but it's probably going to take longer than a TikTok video. But let's give it a go. Disseminated intravascular coagulation, as the name implies, let's just look at that medical term backwards. It's coagulation, so clotting and coagulation of blood, intravascular, inside blood vessels, magpies in the background, and it's disseminated, it's everywhere. Disseminated intravascular coagulation is often triggered by something that initiates a widespread coagulation event in your blood. Now, that could be a septic trigger, such as infection. It could be a major trauma. So a form of DIC is a trauma-induced coagulopathy. It's sort of they're not the same. They have a different pathophysiology. Don't come at me in the comments. I know that TIC and DIC are different, but we're looking at DIC, and certainly trauma can trigger a DIC. A large bleed, an air embolism, a fat embolism, a number of things can trigger somebody into initiating a coagulation cascade. And ultimately that's what it is. And we need to understand there is, remember, a fundamental difference between coagulation and clotting. So in coagulation, we have got the formation of those little stringy strands that we call fibrin. So there's a fibrin or a fibrin deposit that is created inside blood. Okay, so if I have triggered or initiated disseminated intravascular coagulation, formation of fibrin, that fibrin meshwork clogs up tiny little blood vessels. So you get an overall reduction in blood flow through those vessels. Now, if they should be in the heart, lung, brain and kidneys, then of course multi-organ failure and death is going to be fairly swift in that regard. But it's more than just coagulation. It also causes a hemolytic anemia, a microvascular hemolytic anemia. So let's look at what that is. Anemia is when there is an overall reduction of hemoglobin or red blood cells. So red blood cells are trying to travel through blood vessels, obviously to deliver oxygen and carry away carbon dioxide. That's their job. And there would be an expectation that when we have a disseminated intravascular coagulation, there's going to be an upregulation to try and perfuse those organs that were somewhat congested because all those fibrin deposits, those coagulation deposits, were starting to form in blood vessels. But they're like mesh. They're kind of like spiderweb. And as red blood cells are trying to pass through them, they quite literally get cut up. They get lacerated. And that process is called hemolysis. So you get an overall death and destruction of red blood cells during DIC. So it's more than just coagulation. It's destruction of red blood cells, getting cut to pieces by those tiny little strands of fibrin. Now, if I've got destroyed red blood cells, I have poor perfusion, shock. And if I've got poor perfusion, then I've got organ tissue that's starting to die. And if I've got cells starting to die, that again triggers the mechanism for coagulation. Remember, it's cell destruction, releasing things like tissue factor that activate that coagulation pathway and fuel that coagulation pathway. So disseminated intravascular coagulation is widespread coagulation. It's a widespread loss of white and red blood cells. It's a widespread hemolytic anemia. It's widespread organ failure. And it's all triggered by some catastrophic event, like a large blood loss, trauma, an infection, or a sepsis. They seem to be the most common. Disseminated intravascular coagulation. Deadly. So I was just editing that post that I've just recorded outside on disseminated intravascular coagulation, and it dawned on me that I didn't talk about the other part of it. A big part of it is not the coagulation part, but it's actually the bleeding, right? So if I've got disseminated intravascular coagulation, I consume all of my coagulation factors. So I've used them all up, and now I can't stop bleeding. So it's ironic because DIC is not so much about coagulation as it is about coagulopathy. So it's a bit of both. It's widespread clotting and coagulation and widespread bleeding, like simultaneously. And I know that doesn't sound like it makes sense, but think about how you coagulate and how you clot. You clump all of your platelets together to make clots. You use up all of those proteins in your blood called coagulation factors, factor 10 and factor 8 and factor 7, 9, and all of those coagulation factors that we've talked about on many videos before. You use up all of that, and now you haven't got any of that left in your plasma. So you start bleeding. You start bleeding from the mucosa of your eyes, and nosebleeds and gastric bleeds and bowels and teeth and bladder and bruising. Can you see DIC is not just coagulation, but it's also fundamentally the opposite. It's bleeding as well. So that's a consumptive coagulopathy. We refer to that as a consumptive coagulopathy. I promise that's it.